Hi, Dr. Omar here. You may be on a stimulant for ADHD or maybe binge eating disorder if you're on Vyvanse. And you should always keep in mind that no medication comes without risk. And these medications also have a number of risks. The first to consider is the risk of psychosis. Most stimulant medications increase dopamine in your brain, and that neurotransmitter, when too high, can cause psychosis and often even aggression. This is typically more likely when the dose is very high and when the person who takes it has a risk at baseline for psychosis. So it's a rare side effect, but something to consider. In addition, dopamine is related to movement. And if you increase dopamine, you're going to have some abnormal movements. So some patients will get tics or some kind of Tourette's-like syndrome. The stimulant itself can unmask latent and non-parent tics, or it can be a cause of new onset tics. When this happens, we typically prefer non-stimulant medications. Another side effect is weight loss, which can sometimes be a beneficial side effect for some patients, but generally these are not classified as weight loss medications. So it's something to keep in mind by monitoring your weight. In addition, for children and adolescents who are on stimulants, they need to consider growth inhibition, meaning a limiting of total possible height, for example, when they're on stimulants. This is not a huge effect either, but it is something to consider. Some children will go off the medications during growth spurts, for example, parents being worried about this. Another side effect to think about is cardiovascular side effects. So effects on the blood vessels, the heart, the brain. The data here has been somewhat mixed, but there are definitely some studies showing heightened risks for cardiovascular disease outcomes when you're on stimulants, especially for long term and especially at higher dosages. So this is something to consider. If somebody has a history of cardiac problems or a very strong family history, it's something to consider in the risk versus benefit discussion with your clinician. And this is especially true with the amphetamine class of stimulants such as Adderall. Another side effect is a possibility for abuse of the medication or misuse of the medication due to its addictive properties, resulting in tolerance or dependence. In 2023, the FDA did update its classification of warnings for stimulants to include a higher degree of possibility for abuse and addiction, even overdose and death, as compared to previous warnings. So persons who have a history of substance use or abuse or a very strong family history need to talk about this with their clinician to assess whether these medicines are in fact going to be beneficial and safe in the long term. These medications are controlled substances, generally Schedule II, so they should be taken seriously. If you found this beneficial, please check out my free newsletter below or check out this other video here. Take care.